Okay, AJ.
Yes.
I'm so glad you sat down with me today at the new grad forum at Gateway Community College. And beside the age-old adage of wanting to help people, what motivated you to pursue nursing?
I love the science behind it. I mean, for me, since I was a little kid, I've had a fascination with the human body and how it works, and understanding the physiology, and then going on from that to understanding the pathophysiology and pharmacology. Those things. It's thrilling to me to be able to learn about that and actually understand what we're doing when we're treating patients.
Great. Now, was it a second career choice for you? I mean, were you doing something before?
Yes, I had a home building company before that, and when the market crashed, I said, you know what? I'm not really good at running a business. I don't really enjoy it, but I've always loved school. I've loved this learning about this kind of stuff, and I do like working with people. And so, I hopped right back into school, and I went through it as fast as I could.
So when you did your clinicals in school, did that have anything to do with your choice of area of clinical practice in your career?
Yes, I'm a paramedic. I became a paramedic to help me go through nursing school, and so I did hundreds of hours in the emergency department during that schooling, and I really gained a passion for emergency medicine in there. And so, and then in nursing school, doing my preceptorship in the CVICU, I really gained an interest in intensive care. It's just amazing when you've got all these different factors coming together in a really critical patient to have to weigh out and understand,
It's where your
proper
critical
interventions.
thinking skills really
Yes.
come into play. I
And
take
that's
it,
what
yes.
I like about nursing. I mean, that's one of the things I love about nursing.
So, did you have any expectations of nursing school, and was the classroom work what you expected it to be?
Yes, I mean, I expected it to be intense and, to really challenge me intellectually, and it did, absolutely. The educators were great. My instructors were great. They explained things in a way that made them, I wouldn't say easy to understand, but they made them understandable.
So, what do you know now that you didn't know before you went into nursing school?
Like, what kind of advice do I wish I would have had, or
Like, what do you know about having a nursing career, or what a nursing career entails? Is it like what you thought it was going to be? I mean, what you learned in school, is it going to help you pursue your dream of?
Oh, absolutely. Now, besides just having a whole lot more knowledge about, the topics of treating patients and that, one thing I really discovered in school is just how much I love patient education. I love sharing this knowledge with people. When somebody has an illness or their child has an illness, being able to explain it and why we're doing these things, and seeing them just understand, the understanding come together. It's a wonderful feeling.
So, do you have any advice that you wish somebody would have given you before you started?
Yeah, I would say this is what I tell everybody I talk to that is going into nursing or another healthcare related field. Nail those early classes, the early biology and the anatomy and physiology. You really learn those classes, and having that foundation of learning will really serve you well as you go through nursing school, and you have to move on to learn pathophysiology and pharmacology. If you understand how the body works already, you can really see it all. It makes all the other stuff make sense.
Great. So, now I know it's just still fresh in your mind, and you just took the NCLEX about a week or two ago, and you've received your associate degree in nursing. What are your future plans for education?
Well, eventually a master's degree of some sort, for sure, whether that's as a nurse practitioner, CRNA, whatever. But for now, right now, bachelor's degree, and I'm jumping right on that. Next step, just keep moving right on through. There's no reason to put it off, at least in my mind. No reason to hold back on that.
Well, thank you very much, AJ.
Thank
This
you.
has been very enlightening.